Welcome to Good Health, Good Life channel. Today we're diving into a subject that silently shapes the lives of millions, but rarely gets the attention it deserves: mental health. When you think about your health, do you immediately picture your diet or workout routine? How many times have you asked yourself, am I taking care of my mind as well as my body? We pay attention to physical fitness, but why is it that mental health often gets pushed aside? Have you ever wondered why, even when you're physically fine, you still feel drained or unmotivated? Could it be that your mental health is quietly calling out for attention? What if I told you that neglecting your mental health could affect not only your emotions, but your physical health too? In this video, we'll explore how neglecting your mental well-being can lead to health problems and what steps you can take to manage it effectively. The connection between mental and physical health. The connection between mental and physical health is profound and often underestimated. The mind and body are not separate entities. They are deeply intertwined, influencing each other in powerful ways. When our mental health suffers, it's not just our thoughts and emotions that are affected. Our physical health is too. Take chronic stress, for example. It's more than just a mental state of feeling overwhelmed or anxious. When stress becomes chronic, it triggers a cascade of physiological responses in the body. The stress hormone cortisol is released in excess, leading to a host of physical problems. Over time, chronic stress can elevate blood pressure, increasing the risk of heart disease, a leading cause of death globally. It can also lead to insulin resistance, a precursor to type 2 diabetes, and contribute to weight gain, especially around the abdomen, which is linked to an increased risk of cardiovascular disease. But it doesn't stop there. Depression, another mental health challenge, has far-reaching effects on the body. It's not just a feeling of sadness or despair. Depression can weaken the immune system, making the body more vulnerable to infections. Studies have shown that people with depression are more likely to suffer from chronic conditions like heart disease and diabetes. The immune system's compromised state means that even minor infections can become more serious, leading to longer recovery times and a diminished quality of life. Anxiety, too, can wreak havoc on physical health. Persistent anxiety can lead to a range of physical symptoms, including digestive issues such as irritable bowel syndrome, IBS, chronic pain conditions like migraines, and a heightened inflammatory response. This chronic inflammation is a silent contributor to numerous health problems, including autoimmune diseases and certain cancers. What's important to understand is that these are not isolated incidents. Poor mental health creates a vicious cycle where physical ailments exacerbate mental health issues, and vice versa. A person struggling with chronic pain may become depressed, and that depression can, in turn, heighten their perception of pain, making it more difficult to treat. Similarly, someone dealing with a chronic illness might develop anxiety about their condition, which can lead to further physical symptoms, creating a feedback loop that is hard to break. Understanding this connection is crucial for taking a holistic approach to health. Addressing mental health isn't just about improving emotional well-being. It's about safeguarding our physical health too. By managing stress, seeking help for depression, and addressing anxiety, we can break this cycle and improve our overall quality of life. Heart disease and mental health. Heart disease is a leading cause of death worldwide, claiming millions of lives each year. While diet, exercise, and genetics are often discussed as major factors, the role of mental health in heart disease is equally significant, yet frequently overlooked. Mental health issues like depression, anxiety, and chronic stress do more than affect our mood. They have a profound impact on our heart health. People suffering from depression are at a much higher risk of developing heart disease. Depression can lead to unhealthy lifestyle habits like poor diet, lack of exercise, and smoking, all of which increase the risk of heart disease. But beyond these lifestyle factors, depression itself triggers physiological changes in the body that can harm the heart. For instance, depression is associated with higher levels of inflammation, which can contribute to the development of atherosclerosis, the hardening and narrowing of arteries. Anxiety and chronic stress are also major contributors to heart disease. When we experience stress, our bodies release stress hormones like cortisol and adrenaline. While these hormones are essential for our fight or flight response in dangerous situations, chronic exposure to them can be damaging. Elevated cortisol levels can lead to increased blood pressure, higher cholesterol, and greater fat accumulation around the abdominal area, all of which are risk factors for heart disease. Moreover, stress and anxiety can cause the heart to work harder than it should. Over time, this constant pressure on the heart can lead to hypertrophy, where the heart muscle thickens, making it less efficient at pumping blood. This condition is a precursor to heart failure, a serious and often fatal outcome. But the impact of mental health on heart disease doesn't stop there. Mental health conditions can also lead to poor adherence to medication and treatment plans. Someone who is depressed or anxious may be less likely to take their prescribed heart medication, attend regular checkups, or follow dietary recommendations. This non-adherence can exacerbate heart conditions, leading to worse outcomes. The link between mental health and heart disease creates a dangerous cycle. Poor mental health increases the risk of heart disease, and in turn, heart disease can worsen mental health. For instance, a person who has experienced a heart attack is at a much higher risk of developing depression, which can then hinder their recovery and increase the likelihood of future cardiac events. Breaking this cycle requires a comprehensive approach that addresses both mental and physical health. Stress management techniques such as mindfulness, meditation, and regular physical activity have been shown to reduce cortisol levels and improve heart health. Additionally, seeking professional help for mental health issues can make a significant difference. Psychotherapy, counseling, and in some cases, medication can help manage the symptoms of depression and anxiety, reducing their impact on the heart. By understanding and addressing the connection between mental health and heart disease, we can take proactive steps to protect both our minds and our hearts. A holistic approach to health, one that treats the mind and body as interconnected systems, can lead to better outcomes and a healthier, longer life. Immune system and mental health. Did you know that your mental health can directly impact your immune system? The connection between the mind and body is so profound that chronic stress, anxiety, and depression can weaken the immune system, making it more difficult for your body to ward off infections and illnesses. When we're stressed or emotionally overwhelmed, our body produces stress hormones like cortisol. While cortisol is helpful in short bursts, chronic stress causes the body to be flooded with cortisol, which suppresses the immune system over time. This is why people who experience chronic stress or suffer from mental health conditions often find themselves getting sick more frequently. Studies have shown that individuals under chronic stress are more susceptible to illnesses like the common cold, flu, and even more serious conditions like heart disease. The body's ability to produce and maintain a sufficient number of white blood cells, key players in the immune response, can be compromised when mental health is poor. But the effects don't stop at infections. Mental health conditions like depression and anxiety have been linked to chronic inflammation, a prolonged immune response that can actually cause harm to the body. Chronic inflammation is a root cause of many serious health conditions, including heart disease, diabetes, and autoimmune disorders. In autoimmune conditions, the immune system mistakenly attacks the body's own tissues, and chronic mental stress can exacerbate these responses, leading to flare-ups and worsening symptoms. Furthermore, the mind-body connection means that poor mental health can create a vicious cycle, where stress leads to immune suppression, resulting in illness, which in turn leads to more stress and anxiety. This cycle can be hard to break, but it's not impossible. Recognizing the signs of stress and prioritizing mental well-being are crucial steps toward maintaining a strong immune system. There are ways to protect both your mental health and your immune system. Practices like mindfulness, meditation, regular exercise, and a balanced diet rich in vitamins and antioxidants can strengthen your immune response and improve mental resilience. Seeking help from a mental health professional can also provide strategies for managing stress and anxiety, helping to keep your immune system in top shape. Your mental health is just as important as your physical health, and the two are deeply interconnected. By taking care of your mind, you are also taking steps to protect your body, creating a foundation for overall well-being. Digestive issues and mental health. The gut-brain connection is a fascinating and complex relationship that underscores just how deeply intertwined our mental and physical health truly are. Our gut is often referred to as our second brain, and for good reason. The enteric nervous system, which governs the function of the gastrointestinal tract, communicates directly with our central nervous system. This connection means that when our mental health is compromised, our digestive system often suffers as well. When we experience stress, anxiety, or depression, it's not just our mind that is affected. These mental health challenges can trigger or exacerbate a range of digestive issues. For instance, irritable bowel syndrome, IBS, is one of the most common disorders linked to poor mental health. Symptoms such as bloating, abdominal pain, and irregular bowel movements are often worsened by stress and anxiety. This is because stress can alter the normal contractions of the gut, leading to spasms and discomfort. But it doesn't stop there. Conditions like acid reflux and chronic stomach pain are also closely linked to our mental state. Anxiety and stress can lead to an overproduction of stomach acid, which can cause acid reflux and exacerbate ulcers. Chronic stress has even been found to increase gut permeability, often referred to as leaky gut, allowing harmful substances to enter the bloodstream and cause inflammation. One of the most intriguing aspects of the gut-brain connection is how stress and anxiety can alter the gut microbiota, the trillions of bacteria that reside in our intestines. A healthy gut microbiome is crucial for digestion, nutrient absorption, and immune function. However, when mental health is compromised, the balance of gut bacteria can be disrupted, leading to dysbiosis. This imbalance can cause digestive discomfort, inflammation, and further contribute to mental health challenges, creating a vicious cycle that is difficult to break. What's even more compelling is that poor gut health can, in turn, negatively impact mental well-being. Inflammation in the gut has been linked to the production of cytokines, which can cross the blood-brain barrier and contribute to feelings of anxiety and depression. This bidirectional relationship highlights the importance of taking care of both our mental health and our digestive system. Breaking this cycle requires a holistic approach that addresses both mental and physical health. Managing stress through practices like mindfulness, meditation, and regular exercise can help reduce its impact on the gut. Additionally, a diet rich in fiber, probiotics, and prebiotics can support a healthy gut microbiome, which in turn can help stabilize mental health. It's a two-way street where taking care of one aspect can lead to improvements in the other. Understanding the gut-brain connection empowers us to take control of our health in a comprehensive way. By nurturing both our mind and our digestive system, we can break the cycle of poor mental health and digestive issues, leading to a healthier, more balanced life. Chronic pain and mental health. Chronic pain and mental health are intricately connected, with each significantly influencing the other. Conditions like fibromyalgia, tension headaches, and chronic back pain are more than just physical ailments. They are often amplified by poor mental health management. When mental health is compromised, the body's perception of pain changes, leading to an increase in both the intensity and frequency of pain. This isn't just a one-way street. The relationship between chronic pain and mental health is a complex, reinforcing cycle that can be difficult to break. Let's consider fibromyalgia, a condition characterized by widespread musculoskeletal pain, fatigue, and tenderness in localized areas. The pain experienced by those with fibromyalgia is not just a result of physical abnormalities. It's also deeply linked to the brain's processing of pain signals. Research shows that people with fibromyalgia often have heightened sensitivity to pain, a condition known as central sensitization. This means their nervous system amplifies pain signals, making even mild discomfort feel excruciating. But what causes this amplification? Poor mental health can play a significant role. Stress, anxiety, and depression can lower the threshold at which the brain interprets pain signals, making a person more sensitive to pain. In this state, even minor aches and pains can become overwhelming, creating a cycle where pain worsens mental health, and deteriorating mental health intensifies pain. Tension headaches are another example of how mental health and chronic pain are connected. These headaches often result from stress and muscle tension, but they can also be exacerbated by underlying anxiety or depression. A person who is constantly stressed may experience more frequent and severe headaches, which in turn can increase feelings of anxiety and depression. The resulting pain makes it harder to relax and recover, trapping the individual in a loop of worsening symptoms. Chronic back pain is also deeply affected by mental health. Studies have shown that people with chronic back pain are more likely to experience depression and anxiety. These mental health challenges can make the pain feel more intense and reduce the effectiveness of pain management strategies. For instance, a person suffering from depression may struggle to stay motivated to follow a physical therapy regimen, which can lead to further physical deterioration and more pain. This connection between chronic pain and mental health creates a feedback loop that is challenging to break. The pain exacerbates mental health issues, and poor mental health makes the pain feel worse. Over time, this can lead to a cycle of suffering that affects every aspect of a person's life, from their ability to work and socialize to their overall quality of life. However, this cycle can be broken with proper management. A holistic approach that addresses both physical pain and mental health is crucial. Cognitive behavioral therapy, CBT, has been shown to be effective in helping individuals manage pain by changing the way they perceive and respond to it. Techniques such as mindfulness and relaxation exercises can also help reduce the impact of stress and anxiety on pain. By understanding and addressing the connection between chronic pain and mental health, we can develop more effective strategies for managing both. This holistic approach not only alleviates pain, but also improves overall mental well-being, offering a path to a better quality of life. Sleep disorders and mental health. Sleep is not just a time of rest. It's a vital process that rejuvenates the body and mind. Quality sleep is essential for maintaining both mental and physical health. However, when mental health is compromised, sleep is often one of the first areas to suffer. Poor mental health can lead to a variety of sleep disorders, including insomnia, sleep apnea, and restless leg syndrome. These disorders don't just disrupt your nights, they have profound effects on your days as well. Insomnia, one of the most common sleep disorders, is often closely linked to anxiety and depression. The racing thoughts that accompany anxiety can make it nearly impossible to fall asleep, while the feelings of hopelessness associated with depression can lead to waking up frequently throughout the night. This lack of restorative sleep not only exacerbates mental health issues, but also impacts cognitive function, mood, and overall physical health. Sleep apnea, another sleep disorder commonly linked to poor mental health, involves the repeated stopping and starting of breathing during sleep. This condition is often associated with anxiety, stress, and even post-traumatic stress disorder, PTSD. The fragmented sleep caused by sleep apnea prevents the body from reaching the deep stages of sleep, which are crucial for mental and physical recovery. This can lead to chronic fatigue, memory problems, and an increased risk of cardiovascular disease. Restless leg syndrome, RLS, is another sleep disorder that can be exacerbated by poor mental health. This condition causes an irresistible urge to move the legs, often accompanied by uncomfortable sensations. RLS is known to be aggravated by stress and anxiety, leading to difficulty falling and staying asleep. The resulting sleep deprivation can further worsen mental health, creating a vicious cycle that is hard to break. The cycle of sleep disorders and mental health issues is a challenging one. Lack of sleep impairs cognitive function, leading to memory problems, difficulty concentrating, and poor decision-making. It also negatively affects mood, increasing irritability and emotional instability. Over time, chronic sleep deprivation can lead to serious health problems, including an increased risk of heart disease, diabetes, and weakened immune function. Breaking this cycle requires addressing both the mental health issues and the sleep disorders simultaneously. Cognitive behavioral therapy, CBT, for insomnia, stress management techniques, and lifestyle changes, such as maintaining a consistent sleep schedule, avoiding caffeine and screens before bed, and creating a relaxing bedtime routine, can all contribute to better sleep. In more severe cases, medical intervention may be necessary to manage conditions like sleep apnea or restless leg syndrome. Improving sleep is not just about feeling more rested, it's about taking care of your mental health. Quality sleep restores the mind, heals the body, and helps you face each new day with resilience and clarity. By prioritizing sleep and addressing any underlying mental health issues, you can break free from the cycle of sleep deprivation and start living a healthier, more balanced life. Substance abuse and mental health. Substance abuse is often a way people cope with poor mental health, but instead of providing relief, it typically makes things worse. Whether it's alcohol, illicit drugs, or even prescription medications, these substances can lead to dependency. This dependency not only worsens mental health, but can also trigger a range of severe physical health problems. Over time, substance abuse can contribute to chronic issues such as liver disease, cardiovascular problems, and neurological damage. This creates a vicious cycle where the struggle with mental health is compounded by physical ailments. The key to breaking this cycle lies in effective mental health management. Addressing the root causes of mental distress and seeking appropriate help can prevent the reliance on substances and lead to a healthier, more balanced life. By focusing on mental health, we can break free from the cycle of substance abuse and reclaim our well-being. It's crucial to seek help and support. There's always a path to recovery and a healthier future. Cognitive decline and mental health. Mental health issues, such as chronic stress and depression, are not just emotional challenges. They can significantly impact our cognitive health. These conditions are linked to accelerated cognitive decline, contributing to serious issues like Alzheimer's disease and dementia. Chronic stress and depression can accelerate the aging process of the brain. This leads to memory loss, difficulty concentrating, and other cognitive impairments. The more prolonged and severe these mental health challenges are, the more they can affect our cognitive function over time. Managing mental health is crucial for preserving cognitive function as we age. Effective mental health strategies, like regular exercise, a balanced diet, mindfulness practices, and seeking professional help, can help maintain brain health and slow cognitive decline. By taking proactive steps to manage our mental health, we not only improve our emotional well-being, but also protect our cognitive function, helping to ensure a sharper, more resilient mind as we grow older. Curti Feel. Strategies for better mental health management. The good news is that there are effective strategies for managing mental health and preventing associated health challenges. By incorporating healthy habits into your routine, you can significantly improve your mental well-being and overall health. Regular exercise is a powerful tool for mental health. Physical activity releases endorphins, which help reduce stress and anxiety and improve mood. Aim for at least 30 minutes of exercise most days of the week. A healthy diet also plays a crucial role. Eating balanced meals rich in fruits, vegetables, whole grains, and lean proteins can support brain health and stabilize your mood. Adequate sleep is essential for mental health. Ensure you get 7 to 9 hours of quality sleep each night to help your brain and body recover and function optimally. Mindfulness practices, such as meditation and deep breathing exercises, can help manage stress and enhance your overall mental well-being. Even a few minutes a day can make a significant difference. Seeking professional help when needed is crucial. Therapists and counselors can provide valuable support and strategies to manage mental health challenges effectively. Social support and maintaining strong relationships are also key. Connecting with friends and family provides emotional support and helps you feel more grounded and less isolated. By integrating these strategies into your life, you can enhance your mental health and build resilience against challenges. Remember, taking small, consistent steps can lead to significant improvements in your overall well-being. As we wrap up, it's clear that the link between mental health and physical health is significant. Neglecting mental well-being can trigger a range of serious health issues. But the good news is that you have the power to take control. By adopting proactive strategies, you can safeguard both your mind and body. Always remember, mental health is as crucial as physical health. Prioritizing it isn't just an option, it's a necessity. Feel free to explore the suggested products and supplements for your well-being, as advised by your healthcare professional in the description below. Take care of your mind and stay safe. Thank you for watching. If you found this information valuable, don't forget to subscribe, share, and like to stay informed with more important health updates in the future. Disclaimer: the information provided on this channel is for educational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Viewer discretion is advised.